Today, the Calcutta Club and the Telegraph seeks to break that union by this debate. And we have two interpretations of events of the last year that you have come to hear. And as we go on, and as things hot up, it gives me great pleasure to introduce and bring to the dais my professional colleague, Dr. Kunal Sarkar, to speak in favor of the motion.
When Telegraph extended his very gracious invitation for this debate, I was under the illusion that we would be indulging in free speech, till a report came out a few days ago suggesting that it won't be entirely free. As Freedom House UK tell us, we are partially free. And I leave it to the offices of the chairperson and the Telegraph that I belong to the right part. Now there is something going around the air these days called sedition, which most North Indian channels interpret as sedation. And generally they don't know that unknowingly they are speaking the truth. But it is the presence of Mr. Sanjay Hegde that gives me tremendous confidence that should such a action takes place. There is Mr. Mitro in the front line. So please do take care of me if I fall over. There is one person, Mr. Chairman, sir, that my dear friend should not have mentioned in the opening line of anything to do with COVID. It is like you starting a lecture on financial ethics by mentioning Nirav Modi. And that is the name of Tedros with COVID. It is under his callousness that 2 precious months were lost, that if not for the lone warring Chinese doctor Li Wenliang, that the news of COVID would not have broken out to the world. And it is under the very eyes of a corrupt and World Health Organization that 2 precious months were lost in taking effective measure of the pandemic. Sanjay has already mentioned about the airports being open. Yes, no matter how triumphantly nationalistic you are, COVID, unlike the internet, jet engine and everything else, did not originate in India. Those of you who think, perish the thought. It did not. It is not quoted in Indian mythology. It happened somewhere else and it had to be brought to our country. And in order to bring COVID to our country, it is not a pandemic that spread by physical movement. It is a pandemic that spread through flights. And as Taiwan, Thailand, Vietnam, every country in physical proximity of China had shut their gates down, way down in late December, early January. Ladies and gentlemen, we waited till the 20th of March. And in the last 7 days that the flights were open, something around 20 to 25 lakh passengers came in from Europe and United States at a time when Europe and United States were running an infectivity rate of around 20%, which meant that we invited in 5 lakh infections only in the last week through the main airports of Mumbai, Delhi. And look, in Bengal we are far-sighted. So 20 years ago, our forefathers took precautions that we have no international flights. We were all ready for the pandemic. Apart from the few cheap tours to Bangkok or what have you, we had stopped. We were all ready for the fight. But yet, migrant labors and all this introduced the infection to us. And look, even the poor Bengali was not spared. So that is the callousness that brought the infection into our country. And having done that, when Milan was burning, Paris was burning, London was fumbling, in about 24th of March, we decided to go in the lockdown. And when we entered the lockdown, ladies and gentlemen, we had a case count of around 600. About 10 to 11 people had died in India, and we went into the lockdown with the manifest interest that we have to flatten the curve. We are not talking about Hollywood beautiful babes over here. So we wanted to flatten the curve. And 68 days later, when we emerged from the lockdown, we had a 2.5 lakh cases and 7,500 dead. And that is how the curve had expanded. It was looking alluring, but it was a wrong kind of curve that you don't want to look at, ladies and gentlemen. That is where the 68 days lockdown left this country with. The question is why? The question is simply because of the reason, first of all, somebody was under the impression, I don't know who it is, don't quote me for it, somebody was under the impression that this was a general election happening. So we had the entire 3 million square kilometers of India locked down monolithically at once. That is not possible. India is not going to behave as a homogeneous, contiguous entity because the coronavirus may not require a passport or a CAA or an NRC, but it requires time to travel. And this coronavirus came in through the west first, went to the north next, then to the south, and then very reluctantly through the east. So we had no idea what the chronology or the time frame spread of the virus is going to be. We had no granular data from the ground. We had impulsion, we had impulse, we had perceptions, we had bang utensils, 4 hours notice, come on, lockdown, chalega. That is the kind of spirit and knowledge in which the lockdown was maintained. And how did we go to implement this lockdown? The police, everybody worked brilliantly. But it was a law and order exercise. You had the bamboos, you had the thing, you had people being locked in the rooms, you were really, the only thing did not happen is that the corona infected people were not deemed to be under trials. So apart from that, we had a stringent lockdown. But what was missing? When we contained people, we did not test them adequately. When we contained people, we very early in the game, we lost our enthusiasm for contact tracing. So what happened is, after all this barricading, restriction, containment was around, fair enough, we satisfied our physicality of the lockdown, but the epidemiological core of the problem was not addressed to, not in the least, ladies and gentlemen. And why did it happen? Harsh spoke about Team India. Yes, it was Team India, but it was like the football team representing India in cricket. Why was it? Answer me one question this evening. I have very little money. I can ask Harsh to give you a free flat. Who is India's chief epidemiologist? Answer me one question. Every civilized nation on the earth knows who is leading their epidemiology program. There is an entity, friends, in India called the Center for Disease Control, located in Pune. Perhaps the central government thought it was hostile territory, it's in Maharashtra. So perish the thought. I am going to hand over pandemic control to the ICMR, which is an august body of very peace-loving, quiet gentlemen and women who are generally engaged in research. It is a research organization. So how come by bypassing, circumventing the sole entity in India which was supposed to take control of pandemic management, it is handed over to a research organization, because not that you have the right men there, but because you have the yes men there. And 1 month into the lockdown, ladies and gentlemen, I have the slide on my phone if any of you are interested. There was a meeting of a committee which was called the Empowered Committee. The committee was tremendously empowered but very ill-informed. And the committee put up on the wall a PowerPoint slide. Those of you who are interested, I have it over here. And that PowerPoint slide said, this is the chairman of the Empowered Committee speaking on 24th of April, guaranteeing everybody that there will not be a single RNA molecule left on India by 16th of May. This is the intellectual input that went into the formulation of the lockdown, that we thought by 16th of May it will be done and dusted. And why did this happen? Because this empowered committee was sequentially led by a biomedical person, then by a cardiologist, then by a pediatrician. There wasn't a single field qualified epidemiologist to be seen anywhere at a time when 15 out of the 20 leading epidemiologists of the world were Indians. Water, water everywhere, and not a drop to drink. This is the reason, ladies and gentlemen, that why you had a program which had all enthusiasm, which had all restriction, but if you look at the fundamentals of public health, we faltered. We were supposed to add capacity to healthcare. God Almighty, for somebody who's been starving for 73 years, how do you get marasmic Indian healthcare looking like, the abs of Salman Khan in 60 days' time? Not possible, ladies and gentlemen. And we did not lead because at the very maximum, not a single Indian state even used 50% of its capacity. We were separating hospitals. Bengal had 38,000 beds. We coped with 20,000. The rest 19,000 were never used. India had 40,000 ventilators. The maximum record of the number of people ventilated at any single time did not exceed 10,000. And everybody came in. If you had a lathe machine in your workshop, everybody was in the 9 o'clock news manufacturing ventilators. I was praying that the last person not to manufacture ventilators should be the mobile phone companies, because if you had a ventilator drop out for a few seconds, the results will be rather severe, ladies and gentlemen. So thankfully, the mobile phone operators did not get into the queue for manufacturing ventilators, everybody else did. I break another myth in front of you. I should not be sharing these secrets, saying that India is a young population, that's why we've done so well. Of course we are a young population. The birth rate of India has plateaued a decade earlier. So after your birth rate plateaus, if you continue to be a young population, it means you are a bad healthcare. It means you do not know how to keep the 60 plus alive. That is why you are a young population. So there are people going out painting the town red, saying that we are a young population, that's why we've had low mortality. We may have had relatively less mortality, but do take count of the fact that 65% of India's mortality is under 50 years of age. We have not lost octogenarians. We have lost, friends, people in the prime of their lives. What was COVID, friends? Was it an intrusion of a greedy humanity into the environment? What was COVID, friends? Was it the cynical behavior of some country with a crazy scientist? We do not know. But it has taken 102 years for the next respiratory pandemic to appear. I'm sure the next one may not take another 102 years. But whenever it comes, ladies and gentlemen, remember the countries of Southeast Asia, 5 countries added together do not have a mortality of 200. The countries which are nearest to China have had the best possible outcomes of COVID in terms of cases, disease, mortality, and economic preservation. So India had a lesson to learn. And if not for this time, in the words of my friend, Mr. Sanjay Hegde, when he says, for those people who are one meal away from the starvation, you need to absorb the lessons. You need to listen to the right men and not the yes men. There may be contrarian opinion. You have to have the courage of conviction to stand up to it. Yes, we did it. The question you should ask yourself this evening is that did you emerge from the pandemic because of the policies or in spite of the policies. The question you should feel pride or proud about is 1.5 crore of Kolkata, majority stayed indoors during Durga Puja. What US could not do during Thanksgiving, that Europe could not do during Christmas, Calcuttans did during Durga Puja. Feel proud of it because you have done it. Each one of you have done it. Otherwise there would be beds lined up across 5 kilometers either side of the pavement. We owe it to the people of Dharavi, ladies and gentlemen. When the government had run away, the self-help groups of Dharavi came together. And when the country had given up on Dharavi, the people of Belgachia, the people of the slums of Delhi, the slums of Mumbai, they got together. So the government fumbled, but the people triumphed.
Kunal, you need to wind up.
I will, Shandip, but let the lessons not wind up, because COVID has come to us with very sharp pointers. And if India has to be empowered and Atmanirbhar, then we have to have the Atma Vishwas to face up to facts as they stand and not to facts as we want it. Good evening, ladies and gentlemen.
Thank you, Kunal.